Tailbone pain relief. Tailbone pain. You probably never gave your tailbone a single thought until it started to hurt. Tailbone pain is centered at the very bottom of your spine, right above your buttocks, where this multisegmented bone sits. The tailbone is small, but it does have a few important jobs. It helps stabilize you when you sit. Also, many tendons, muscles, and ligaments run through the area. Your doctor might call your tailbone by its medical name, coccyx. The word comes from the Greek term for cuckoo. The name was given to the tailbone because the coccyx looks a lot like the beak of a bird. Pain in your coccyx is called coccydynia. Pain from an injured tailbone can range from mild to intense. The pain can get worse when you sit down, stand up from a chair, or when you lean back while sitting. You can also feel soreness when you use the bathroom or have sex. Women may feel discomfort during their period. Sometimes, the pain can shoot all the way down your legs. Standing or walking should relieve the pressure on your tailbone and ease discomfort. Why your tailbone hurts. Your tailbone might have started hurting after sitting on a hard bench or other uncomfortable surface for a long period of time. Falls and other traumas can bruise, dislocate, or break your tailbone. Joint damage from repetitive motions or general wear and tear from aging can also contribute to tailbone pain. During the last trimester of pregnancy, the ligaments connected to and around the coccyx naturally loosen to make room for the baby. That's why women are about 5 times more likely trusted source than men to experience tailbone pain. You're also more prone to tailbone problems if you're overweight. However, if you lose the weight quickly, you'll lose the padding that protects your tailbone and may be more likely to injure it. In rare cases, the cause of coccyx pain may be an infection or tumor. What should I do if my tailbone hurts? See your doctor if the pain is severe or lasts more than a few days. Most of the time, tailbone pain isn't serious. It can sometimes be a sign of an injury. In very rare cases, tailbone pain can be a sign of cancer. You may get an X-ray or MRI scan to look for signs of injury, such as a bone fracture or a tumor pressing on the bone. X-rays may be taken both sitting and standing to show possible problems with your tailbone in different positions. The doctor will also feel around the area for any growths that might be putting pressure on your coccyx. Treating tailbone pain with over-the-counter medications. The pain should go away in a few weeks, but it may sometimes be months. You can try over-the-counter nonsteroidal anti-inflammatory drugs (NSAIDs) to relieve discomfort until your tailbone heals. These drugs include ibuprofen, Motrin, Advil, or naproxen, Aleve. Acetaminophen, Tylenol also can relieve pain. For more severe pain, your doctor can inject a local anesthetic, nerve block, or steroid medicine into the area. Some people get a combination of anesthetic and steroid injections. You can also take an antidepressant or anti-seizure medication by mouth to ease the pain. Be sure to discuss your treatment options with your doctor. Sitting position to treat tailbone pain. To ease discomfort, sit on a heating pad or ice pack, or go for a massage. The way you sit also matters. Poor posture can put too much pressure on your coccyx. Sit with your back against the chair and your feet flat on the floor to take the weight off your tailbone. Lean forward when you go to sit down. You can also sit on a special donut-shaped pillow or wedge-shaped cushion to relieve pressure on the sensitive area. Advertisement. Get answers from a doctor in minutes, anytime. Have medical questions. Connect with a board-certified, experienced doctor online or by phone. Pediatricians and other specialists available 24/7. Physical therapy. To treat tailbone pain, a physical therapist can show you exercises to strengthen the muscles that support your tailbone. These include your stomach muscles and pelvic floor. You can also try a technique called coccygeal manipulation. This is when a doctor inserts a gloved finger in your rectum and moves the tailbone back and forth to shift it back into position. Surgery to treat tailbone pain. Most of the time, these treatments will relieve your pain until your tailbone heals. If no treatment has worked, your doctor might recommend surgery as a last resort to remove part or all of the coccyx. This procedure is called a coccygyectomy. Surgery doesn't always work right away. It can take time before the pain goes away. In some cases, it doesn't work at all. Surgery can also carry risks, like infection. Whether or not to have surgery is a decision that you need to make very carefully with your doctor. Start with home pain relief measures like NSAIDs, heat, and massage. If your tailbone still hurts, check in with your doctor, who can help you find a treatment that works for you. Exercises and stretches for tailbone pain. While there's no instant cure for tailbone pain, some exercises and stretches can help relieve the pressure that causes tailbone pain. Various yoga poses can be wonderful for stretching out the muscles and ligaments connected to the tailbone. Pregnant women with tailbone pain can also benefit from stretching. Talk to your doctor if tailbone pain is worsened by exercising or stretching. Fun fact: your doctor might call your tailbone by its medical name, coccyx. The word comes from the Greek term for cuckoo. The name was given to the tailbone because the coccyx looks a lot like the beak of the bird. Pain in your coccyx is called coccydynia. Healthline challenges curious about mindful eating. We can give you a taste. Are you ready to give mindful eating a shot? Our nutrition newsletter can help you try it. Take the Mindful Eating Challenge and learn how to create lasting, healthy habits around food.